From that, private hospitals in the Ashanti region and Savannah regions are facing pressure following a nationwide strike by the Ghana Registered Nurses and Midwives Association. Now, patients, including expectant mothers and those in need of urgent care, have resorted to private medical facilities after being turned away from public hospitals. The following report has more.
The Oak Specialist Hospital at Santasi and Opoku Transport Private Hospital in Asokwa Kumasi have seen a surge in patient numbers since the start of the industrial action by the Ghana Registered Nurses and Midwives Association. Hospital administrators are, however, expressing worry over the impact of the strike on the capacity of their facilities, particularly with critical cases that require the attention of major public hospitals.
Since the strike started, we have a lot of clients trooping in, and it's advantageous to us as a private facility. But the negative side is when it occurs that a client has a serious case and it exceeds our capacity, it occurs that we have to transfer them to these government hospitals, and now it looks like nurses are not on duty, and it will affect the client negatively. The client will not be able to have a proper medical assistance.
At the Pampaso Children's Hospital, Pokuya Gladys, who was in labor, was reportedly left without care. Her family had to transport her to a private facility, a journey that came with emotional and physical distress.
Now I'm coming to see her. And now I'm going to call the Obu baby. I striking to a chair. And then run at me the bar.
Sources also indicate that a patient scheduled for a critical amputation surgery at the Suntreso Government Hospital was left unattended, with no staff available to assist with the operation. The patient has been transferred to the Opoku Transport Hospital for medical care. Ruby Pearl Juma, the account manager at Oak Specialist Hospital, described the health minister's appeal to retired nurses to volunteer as an ill-advised and ineffective solution.
There's a reason why they are retired, and so when someone retires, allow the person to rest. There are a lot of people I know are even yet to be posted, and there are even those that have gone on strike. There is a reason why they are on strike. So calling on retired nurses to come back, I don't think that will solve it. How many retired nurses do we have? Can we compare the working group to the retired nurses? No. And how long can even these retired nurses hold the fort?
Meanwhile, the St. Anne Catholic Hospital at Damongo in the Savannah region, which is the only facility residents can rely, is currently overstretched as a result of the strike. A visit by City News to the hospital last night revealed significant pressure at the maternity and female wards due to the industrial action. A midwife at the hospital, Sandra Tom Derry, told City News that they recorded 27 admissions in a single night.
Yesterday, we saw a rather high increases in the number of cases we have at the maternity ward. Usually, the ward is usually busy, but yesterday it was extremely busy. We had a total admissions of 27. And management had to come in at some point to provide a ward, one of our old wards that has not been in use for a while. The place was cleaned up, and some of the clients moved there just so that they will not lie on the floor.
For now, the burden heavily relies on private health facilities and the patients who rely on them. But the question remains, for how long can they hold the line? For ChannelOne News, I am Bright Tieboa.